Okay, Alexa, thank you. So in today's Health Matters, 2 measles cases in Manhattan triggering fears of an outbreak now.
Yeah, and could a new COVID variant be to blame for a possible spike in new cases across New York City? Well, joining us this morning is Acting New York City Health Commissioner Dr. Michelle Morse with what we need to know to stay healthy and happy.
Yes.
So good morning. Great to have you here.
Thank you for having me. Good morning.
So tell us a little bit about the measles here in Manhattan, and are we in danger at all of an outbreak happening?
So first and foremost, we are investigating on the Lower East Side and in SoHo an exposure to measles. We've currently identified 4 cases that are related to this particular exposure. What's very important for New Yorkers to know is that the risk to New Yorkers, especially those who are vaccinated, is incredibly low. And our disease detectives are working very hard to make sure they let everyone know who may have been exposed in these 2 areas, what their risk is, to make sure they're vaccinated and make sure that they don't develop any symptoms.
So just to be clear, the number was 2, now it's 4?
This is part of how our investigations happen, is that as we investigate, we talk to more people, we find out who might have been exposed, and we're able to track.
And those
but
4,
that is correct.
All 4 of those individuals were unvaccinated.
So there were 3 people that were in very close contact with one first case that we identified. And so those 4 are all related. Again, 3 related to very close exposures to a first identified case. And that brings us up to 15 total cases of measles this year in New York City.
But are all those people unvaccinated?
So what's important to know actually is that they're all adults.
Okay.
And the risk, again, to New Yorkers is incredibly low. All 4 of these folks.
Right, but I'm asking about the vaccination question because at some point you need to get a booster for measles. I'm trying to figure out what exactly the guidance is.
So for adults in general, if you've had 1 vaccine dose at a certain age in the 1980s and 1990s, that was enough. Now, if you've had 2 doses or you've seen your provider and you've gotten measles titers to make sure that you're vaccinated, that you are covered, then you're all set.
Okay, just real quickly though, symptoms, and what happens if you don't get treated, if you're just like, I'll be fine?
Right, this is incredibly important. So measles is one of the most infectious diseases and spreadable diseases that exists. And so if you have any symptoms at all, of course, what's most important is that you see a provider immediately. We want people to know that the average New Yorker has very, very little risk. This is something that is really confined to these exposures in the Lower East Side and in SoHo.
Okay, so thank you very much for explaining all of that.
Sure.
While we're talking about vaccines and what people should be doing, COVID variant right now, is there a new variant that is causing an uptick of cases in New York City?
So we often actually see a slight increase in cases in the summer and early fall. What we're seeing right now is that our surveillance and monitoring of wastewater shows that we are seeing some increases in COVID. We've had a small uptick in hospitalizations for COVID for very, very young kids and then people over the age of 75. We're watching that very closely, but right around the corner is respiratory viral season. And so this is right around the time when we're recommending people go ahead, get their COVID, flu, and if they're eligible, RSV vaccines.
What is going to be the availability, though, of COVID shots?
This is incredibly important. So because of actions by the governor and the New York State Health Commissioner and our teams all working together, there is now access for the COVID vaccines. This is because there has been an executive order that makes sure that pharmacies and pharmacists are able to administer the COVID vaccines. That's really important because we want to make sure that access is unchanged. Whoever wants a COVID vaccine should get one. And then again, I recommend everyone get the flu vaccine and everyone who's eligible get the RSV vaccine as well.
So folks can still walk into their local pharmacy, CVS, Walgreens, whatever it may be, and have that shot provided without a prescription.
Correct, without a prescription. That's exactly right.
Let's talk about the Legionnaires outbreak. Last time you were here, you had talked about how kind of it was over, but then there were still some cases that were popping up after. So can you explain how you can say it's over, but then there were cases afterwards?
Absolutely. So we did a very extensive investigation this summer. The summertime is when Legionella grows rapidly because of the warm weather and warm conditions. We were able to identify a total of 114 cases. 90 people were hospitalized, and unfortunately 7 people passed away. Over the course of about 6 weeks, our investigation was able to identify the sources of those Legionella bacteria spreading, and was able to cut it off with very, very strong treatments of the cooling towers to stop the bacteria from spreading. And this could have been much worse if we hadn't identified it as quickly as we did, gotten out and treated those cooling towers with the building owners. All of those things could have meant more cases and more bad outcomes. So we are, happy that we've been able to close out the investigation as of August 29th. And it is true that it takes some time sometimes for us to investigate anyone who's diagnosed with Legionella to make the link to this cluster.
Just real quickly, can you clear something up for us? Because we've heard differing opinions on whether or not you can get Legionnaires through the shower.
Yes. So there's 2 types of investigations.
Okay.
This investigation in Central Harlem this summer was from Legionella spreading from cooling towers at the top of buildings with fans spreading kind of droplets of water outside. There's a second separate type of investigation that also happens where if we have 2 cases of Legionella diagnosed in a single building within 12 months, then we would be concerned that there might be Legionella in the water system inside that single building. That's a separate investigation from what happened this summer in Central Harlem.
But you can get Legionnaires through your shower?
This is only in some very specific cases, but it is possible, and it's a different kind of investigation than what happened this summer.
Okay. Dr. Michelle Morse, appreciate you being here. Come on back to give us the shots, okay?
I'm happy to.
We're ready.
We're ready. We'll roll our sleeves up.